Hello. Today we want to talk about capsular contracture after breast augmentation. This unfortunate complication occurs about 10% of the patient who undergoes breast augmentation. Even though there was no initial complications from the procedure, roughly about 10% of the patient's population will likely to develop this capsular contracture. The surgeons and we're always looking for the cause and the cure and the treatment for these conditions, but there's no magic bullet at this point. However, there are a few things we could do. Before we begin, we want to talk about capsular contracture. The capsular contracture is a hardening of the breast. The reason that became harder is because the outside capsule, which is a scar tissue that body forms after the breast augmentation, tend to shrink. So when you think about this situation, the implant goes in the under the breast. Now the body forms scar tissue surrounding the implant. This capsule, which is a scar tissue, over time in some patients tend to shrink. So in other words, the outside bag will tend to squeeze the inside bag, and that's what we call capsular contracture. So whatever the reason it is causing this contraction, we need to find out. Some people we can tell because maybe she had some kind of a minor infection or bleeding or some sort, and in those events that cause inflammation may have contributed. But a lot of times we cannot tell or pinpoint what went wrong or what was wrong at the time of initial procedure. And often patients who come back with capsular contracture has no recollection of anything going wrong with initial operation. So patient who develop this condition is typically very difficult to control. And if the condition is on one side, for instance, only one side is hard and one side is softer, then something that we don't know or we didn't know at the time of procedure was not the same in both breasts. So by removing the capsules and let the body forms a new capsule will be the treatment choice and most likely successful. However, in patients who develops bilateral capsular contracture will be a little bit of a problem because we don't know what caused it. So removal of the capsule and replacing the implant will be a first treatment of choice. But again, since we don't know the exact cause of the capsular contracture, a lot of times we will see the recurrence. So in a few patients that's really resistant to this type of procedures, we will need to have different approach. And currently, the last resort type of procedure is the use of what we call ADM. ADM is a biological material that was made from the cadaver skin or bovine skin, and this is sheet of tissue will be placed at the time we remove the capsule, and putting this in place of capsule will form a new capsule incorporating this tissue material, and this tissue material does not shrink. So the idea is this will trigger the non-shrinkage of the capsule, and we've been treating this type of condition with ADM for a number of years, and we are fairly successful. So there are a few things we could do to treat capsular contractures. This is a very difficult situation for some patients who develop this condition, but there are a few things we could do. So how do you know you have a capsular contracture? So it's just basically breast getting harder. So when you touch the breast, it feels harder. Typically, after breast augmentation, breast gets softer and softer and softer, and then should stay soft. But people with capsular contractures they will notice the breast getting harder again. Typically, it's 3 to 6 months after surgery. And so I usually tell the patients, just keep watching out. Make sure that the breast stays soft after surgery. And if breast stays soft for 6 to 12 months after breast augmentation, most likely you're not one of those patients who develop capsular contracture. Also, the capsular contracture has some degrees of severity. Some breast capsular contracture may be just a little bit firmer, but the medium severity capsular contracture could be harder but looks a little bit distorted in shape. Usually, typically, you will see the breast implant will rise high and the breast will look a little bit more round. And the serious case or more severe cases, you may experience some pain associated with the tightening of the capsule. For more information, please call us or visit our website at alexkimmd.com. Thank you.